My name is Emily Cline, and I'm a physical therapist at HonorHealth Shea Medical Center.
Hi, I'm Robin Samaddar. I'm an emergency medicine physician at Shea Hospital. I also work at Thompson Peak in Osborne. I'm currently the medical director at Shea Hospital.
My name is Steuter, and I'm an occupational therapist at HonorHealth Shea.
Hello, my name is Celeste Cesario. I'm an RN in the ICU here at HonorHealth Shea.
My name is Mahurin, and I work at the Scottsdale Shea Medical Center inside of microbiology.
So with physical therapy, we work with patients here in the hospital to try to restore the function that they've lost, to get them back as independent as possible and to get them to the appropriate level of care. And the people that inspire me most to do this is by far the patients. They put in the work. We tell them what to do, but they put in the work to try to get themselves better and get back to doing what they love to do. So we work with them to set goals that they want to achieve. So that's been, the most impactful thing for me is just working with the patients.
With these COVID positive patients, there's a lot of physical barriers. So the patients are in an isolation room, meaning they're in a negative pressure room away from everybody else. The door is closed, which isn't normally the case. That can be very isolating to some people, as you can imagine. Another big thing is that families are restricted from visiting. That's another huge and isolating thing. I can't even imagine what it would be like to not be able to have my support person there, the person that I trust the most. And then on my end, and I'm sure other nurses can say the same, there's the PPE that we wear. We're wearing a face shield or goggles. We're wearing a mask that covers our face. We're wearing gowns that cover our scrubs, shoe covers, gloves. There's almost no humanity in that situation. But as nurses, we can bring humanity into a situation like that. That's really scary for our patients. So how do I overcome all these barriers? Using touch, so holding a patient's hand when you're trying to convey something to them, whether it be the plan of care or, letting them know that a family member said, I love you. Tell my family member, tell my husband, my wife, my daughter, my son, that I love them. Holding their hand, that's a huge thing too. It conveys, I'm here for you, I'm your advocate, and I care about you.
The most inspiring part of my job is being able to help these patients who are experiencing such a difficult time with all of the complicating factors surrounding this unprecedented virus. To address these challenges, the therapy team has implemented a delirium prevention program to address the cognitive needs of these patients due to lack of human interaction and being isolated.
Our palliative care and our chaplain team have been really amazing at working out the technological difficulties that we sometimes have with the iPads and things. And a lot of the family members don't just use FaceTime, they use WhatsApp, and there's other video programs that we use to help connect families with their patients with their families. So this has been really helpful. It's not the same as having your family member there in person, of course, but it's something to bring the humanity back into the situation.
So what inspires me to do what I do here in the lab is accurate results, timely results, obviously, because that's a large part of what we do with the whole COVID thing, and also working with, answering phone calls from nurses and doctors and questions that they may have, or, just kind of that teamwork, even though I don't work directly with them. But just still there's that teamwork because we're all, the same goal.
My coworkers are amazing. I learn from them every day. They give me so much advice and so much guidance. And we've got a lot of experienced therapists here.
I think that the most important inspiration is that it gives me the opportunity to make a difference. I had an wise emergency medicine physician once tell me that it's not about why they come in, it's about us answering that question for those people that quite frankly don't know. When it comes to during this COVID crisis, we have patients that come in with a little cough, a little sneeze, who are walking well, walking healthy. There's no reason to put that patient down. It's basically to answer that question because that's why we're there. We're there to make somebody feel better, to answer those questions. And we also have the sick patients that come in as well too that can answer those questions. And whether we have to put them on a ventilator, The inspiration there is just making a difference and to answer those questions and, quite frankly, make people feel better. As a physician, as an ER physician, it's not just in the emergency department. It's when I get a phone call from a friend or a neighbor asking, is it okay to travel? Is it okay to go out in public and go to a restaurant? So I'm there, we're there to answer those questions, whether it be something super simple or super complicated.
I would like to recognize all of the doctors and nurses who have worked tirelessly to serve these patients and provide the best care. It has truly been an amazing experience to be able to collaborate with the doctors and nurses to come up with innovative solutions to meet the unique needs of these patients in this new virus.
Number one is my ICU nurse team. I couldn't do it without you guys. Your knowledge, your assertiveness to help, everything. I mean, if I call for help, you're there. I know that I can rely on you guys, and I really appreciate that. We have a PCT on the COVID side that's always there. They've been so helpful with just doing turns. If we're in a room and we forgot something, instead of taking off all our PPE, we can just ask them to hand us something. It's been amazing. They help us keep our trash emptied, which is insane because those things can really overflow.
I have to recognize my supervisors, which are awesome to work with. Angelica Milik and Benny Reed. They've worked hard and done a lot. These past few months have been crazy.
The whole therapy staff, physical therapists, occupational therapists, speech therapists, we really tried to work collaboratively to bring the whole package to the patient. And then we work a lot with other healthcare professionals. So that's something to be super thankful for. We learned so much from pulmonologists, from respiratory therapists, just on the best way to try to treat this and get the most out of our sessions with the patients.
Next, I'd like to recognize our intensivists. We couldn't do our job without them. We have a multidisciplinary team in ICU, so everybody works together. There's no one who could do their job without the other. Dr. Seth, Dr. Brave, Dr. Asar, Dr. Gupta, thank you for doing what you do. We appreciate you. The resident doctors, there's too many to name, but you guys are amazing, and thank you for your support. Our palliative care team, Dr. Thompson, Janelle, thank you for what you do. Thank you for helping us connect with our patients, and thank you for being an advocate for our patients at the end of life. Our chaplains, Francisco and Renee, you guys are also amazing. You guys are also wonderful advocates and a huge support for us nurses too in these really trying times.
And so they're just the teamwork ethic too in the lab, and just all the other techs, just jumping in when we get really busy and just kind of filling in the gaps and helping out, which I really appreciate.
Case management, you guys help connect with things outside of the hospital that need to be done for the patient, and you also are a huge support for us as nurses and for our patients. Amanda, our pharmacist, you are amazing. Whenever I have a question about a medication, how to administer the dose, whatever it may be, you're there and you're super smart and we love you. In addition, we've got physical and occupational therapy, making sure that our patients are mobilized. We do a lot of that work ourselves, but you guys help evaluate baseline for us. Our dietitian, making sure our patients get fed properly, they get the proper nutrition they need. And then our housekeeping services, I can't say enough thank you to you guys, because you guys are putting your life at risk as much as we are. And you keep us clean and safe, and you keep our patients' areas clean and clutter-free. And I thank you for that.
Outside of work, my family back in Missouri, I talk to them daily just to kind of unwind.
During this crisis, I get to come home to 3 kids that are consistently there every day since they're not in school and activities. So I know I have their support as well as the love of my wife. So they have been instrumental as far as getting me through this and seeing the frustrations, both as an emergency medicine physician as well as a hospital administrator or hospital leader, because there have been frustrations during the process of COVID. And I say the process because there's been a lot of processes and doing things differently.
At home, I'd like to thank my husband. He's my #1 support. His name is John. He makes sure that the house is clean when I come home. He draws me a bath if I need it. He has food ready. He's the best. I can't say enough about him. My sister has been a huge support too. She doesn't live in the state, but it's just nice to have somebody to talk to.
And then my husband, Pablo, at home. He takes the brunt of what I bring home from work. So, and he's been great. He cooks for me, so I can't complain about that.
But also my nursing team at Shea, between the Andrews and Kathleen's, who they know who they are, as well as the nursing staff, the support and getting through this crisis and just being a team. And, you know, we can't do this by ourselves. And, you know, the common phrase, there's no I in team, but without the team and being open to things and to change and to working things out sometimes on the fly, they've been invaluable.